Greetings from Izmir, Turkey. This is Dr. Servet representing Ege University Faculty of Medicine. Dear students, I would like to give you a brief information about our faculty to those of you who are interested in medical education. Our faculty is established in 1955 together with the Ege University as a whole. It is one of the first faculties to be established in the university. And Professor Dr. Biçeroğlu is one of the founders of our faculty and was appointed as the first dean of the faculty and is a very important academic person in Turkish medical history. And the medical education started in the same year, academic year, with 90 students. 20 of them were foreigners. And the first medical doctors were graduated in 6 years after. And the first departments of our faculty were founded in 1958. And now currently, we are a big health complex with 43 departments. And in this health complex, we have also a separate oncology and the children's hospital within our structure. So our medical education has been carried by integrated medicine education programs since 1990. After 2003, the system has been updated to the vertical integration program. And with this new approach, the education offered by different departments of the faculty was reorganized within the framework of subject integrity. And these different disciplines are appointed for a certain subject and offer the education as a whole, which is important for medical education. This approach ensures better understanding of medicine because all medical sciences serve for the well-being of the human body and they cannot be distracted from each other. So where are we located? So we are located in the city of Izmir, the ancient city of Smyrna, and we are a metropolitan in the western extremity by the Aegean coast. We are economically and socially a dynamic city, and we are the third populous city in the country. So why should you select our faculty? Because we have outstanding educational and research opportunities. As I mentioned before, we are a big health complex and we are the reference hospital in the region. And we have a broad spectrum of patients coming to our hospital. And during your education, you will have the very experience you can for medical education. And we also have many research opportunities, and our university is the pioneer representative of the fourth generation university concept. So we have many research opportunities and programs. And we accept top-level students in the National University examination, and our graduates are among the top list of medical specialization exam, which we call TUS. So our educational system enables the students to receive both medical skills as well as lectures regarding to basic and clinical sciences from the very beginning of the first year of their education. And we have a strong infrastructure opportunity. We have various modern laboratory and clinical equipment to improve good medical skill practices. So we are one of the first medical faculties that has been approved by the National Medical Education Accreditation Board, which we are very proud of. And through the scientific research activities and awards, we have national as well as international projects. And we are, as I mentioned before, a leading research center in Turkey and in the world. So we have a strong academic staff and very experienced academic staff with many capabilities. And we have this staff has enough capabilities to carry both the hospital work, the education, and the research activities in the university. So I want to show you some more numbers, but the important thing here is the student teaching staff rate I want to mention. It's around 6, which is a good number, and our teaching language is Turkish, and the duration of the medical education is 6 years. And yes, we are integrated to the Erasmus program, which is the most frequent asked questions from the students. So we have some programs we offer for better education, and I want to mention some of them here. We have a simulated patient lab. So in this patient lab, during the first years of their education, the students act as real doctors there, and the volunteers act as patients. And we have a pre-organized story, and the students improve their skills on history taking and physical examination skills on healthy volunteers. At those years, they are not specifically asked to make diagnosis, but the main aspect here is to improve their communication with the patient and to learn how to approach a patient from the first year of their education. And the lectures are then they have, after the lectures, they have a feedback from their mentors. This is a one-to-one mentor-based program. So they have their feedback, and they will then know in which aspects they have to improve themselves, and they have a criticism of their own performance. We have a special study module, which is again during the second and the third years of the medical education. And students here have the opportunity to make one-to-one contact and practice with their mentors. The mentors release some topics they want to work on, and the students are free to choose one of them. And the topics are not necessarily related to medicine always. They can be related to art, foreign language, social responsibility projects for the society. This module is performed to gain you new skills such as communication, time management, and oral presentation. And you are welcome to bring your own brilliant ideas to this module and brighten your existing skills and express yourself as a student in the way you want to. So we also have researcher training programs, which is again a very important program, we believe, because the purpose of this program is to contribute to the training of future scientists. You are here again working with your mentors, you're making one-to-one practice, and you are basically learning how to make a project. You make a hypothesis, you collect the data, and you evaluate the data with your mentors, you get results, and you discuss the data, and then you can make a manuscript out of it at the end. So this is basically learning how to make research and improving your researcher skills. And we also have communities, student communities, who are actively working, and 17 communities working in different fields like cinema, modern dance, cycling, theater, music, scientific research communities. And these activities aim to improve the social capabilities of the medical students and with some cultural activities, and also to entertain them and to have an entertaining learning. And about Erasmus and education and internship mobility programs, student abroad exchange program exists in our faculty. Internship opportunities in different countries we have, such as Germany, France, Spain, Netherlands, Denmark, Portugal, Poland, Lithuania, Greece, Bulgaria, and Macedonia. So you can be, these are the countries you can have internship along with your education here in our faculty. So at the end of the 6 years, you become a medical doctor, and we have a traditional graduation ceremony for you, which is an important day for our faculty. And you say the Hippocratic oath with your classmates and your mentors. And it's a really emotional and exciting moment, which we have all been through. And this graduation, after this graduation ceremony, you become a doctor. So after becoming a doctor, you can work as a general practitioner as many as you want for any period of time. And as a general practitioner, you can work as a physician in the community health centers, family health centers, and emergency departments. The general practitioner who wants to specialize in a field has to attend a centralized exam, and this is called specialization exam in medicine, an important exam for the graduates who want to be specialized, a hard exam, and we call it TUS, and it's basically a point-based exam, and the students are distracted and distributed according to the points they have from the exam. So you can also become an academician and making researches in the medical faculty together with the teamwork, and you can step into academic life, and you can be a professor, an associate professor, an assistant professor. But these have to be discussed, or you have to decide this once you step in the medical education and you become a doctor, and you will decide these throughout your education. You will have plenty of time for this, and plenty of experiences are here for you to decide your best career. So I want to thank you all for listening. I hope I could give you a brief information about our faculty, and thank you again. Goodbye.